Hi, I'm Dr. Brian Wong, founder and CEO of the Bedside Trust. Welcome back to video number 5. In the previous 3 videos, we've established that what matters most to patients, what matters most to physicians, really what matters most to all of us in healthcare is this state of being trusted. We wanted to see if that simple 7-letter acronym, teamwork, responsiveness and respect, understanding, safety, talent, execution, dedication, could better inform our roles as patient-driven leaders. In other words, give us definition of what role clarity means in working practical terms. Let's first consider the bottom 3 letters: talent, execution, dedication. Our point of view is that in healthcare, we have overcorrected in focusing on those 3 attributes almost at the exclusion of the other 4. Consider, if you will, a surgeon who is supremely talented, who may be known as golden hands, the biggest admitter in the hospital, who executes, gets results, might be the first one in the morning and the last one out in the evening, but who may also lack teamwork, responsiveness, and respect, who may lack understanding and safety. In many instances, that individual might be rewarded for just those 3 things. They might get preferential block times, a better parking space. They may get to serve on some of the better committees, to be on the medical executive committee, perhaps to be elevated to chief of staff, and therefore to serve as an ex officio member of the board of trustees. And they're getting rewarded almost for the wrong behaviors. We almost forgive or excuse the absence of the top 4, or perhaps the opposite of the top 4, because they're so good at the T, E, and D. T, E, and D is really about how we perform in our jobs. We all have unique jobs. A physician's job is different from a nurse's job. A nurse's job is different from a therapist's job. A therapist's job is different from a unit coordinator. That's different from food service. That's different from the back office in admitting or payroll or shipping and receiving. We all have unique jobs. And in the performance of our jobs, we're all expected to be talented, to execute, and to be dedicated. But now let's consider the top 4, T, R, U, and S. Our point of view is that begins to define our role in the organization. And that role is not unique. That role is universal, which is to say everybody in the organization should have one role and one role only. That role is to be a team player, to be responsive and respectful, to be understanding without judgment, and to create safe conditions for everybody else. If everybody fulfilled and honored that role, we would be much further along in creating the conditions that would provide what matters most to our patients, to physicians, and to everybody else in healthcare. T, R, U, and S to us defines our role. T, E, and D defines our job. Together, T, R, U, S, T, E, D defines role clarity. The role of a leader through role modeling and demonstration and personal conduct is to demonstrate by their daily actions, attitudes, and behaviors that they are team players, responsive and respectful, understanding and safe in the daily execution of their jobs, where they are expected to be talented, to execute, and to be dedicated. You must have all 7 to be a trusted colleague, to have achieved role clarity, and we believe this begins with leadership. Leadership must set the tone for the entire organization, and that's how we have really come to believe on this idea of patient-driven leadership with role clarity, as represented by the trusted acronym, to begin, first and foremost, with the leadership of the organization. Thank you.